Welcome, Solver Sona Shah, CEO, Neopenda.
Good morning. If you've ever been inside a hospital ward here in the US, I'm sure you've noticed the hundreds of thousands of dollars of medical equipment. Well, in low-resource hospitals and settings such as Uganda, we do see tens of thousands of dollars of equipment, but it's typically broken and in a room like this. It's called the equipment graveyard. Most commercially available medical devices fail to meet the unique constraints of 85% of the world's population. And this is anything ranging from power instability to wireless connectivity to cost and difficulty in maintaining medical equipment. So naturally, patients are suffering most from this strain. UNICEF estimates that 68% of newborn deaths in emerging markets are preventable with access to high-quality care. 68%. But how do we expect nurses and doctors to actually deliver this high quality of care if they aren't given the tools and resources necessary to do so? Well, that's why we created Neopenda. I'm Sona Shah, and I'm CEO and co-founder of Neopenda. We're designing and implementing medical technologies, needs-based medical technologies for emerging markets. We focus all of our efforts on human-centered design. It's the only way we've found that solutions can be appropriately designed and implemented so that they don't end up in that equipment graveyard. Our team spends a significant amount of time with our end users, primarily neonatal nurses in low-resource wards. There was one time when I was shadowing a nurse in the hospital and just kind of observing what was going on, and there were 90 babies in this ward in a room smaller than this size. 90 babies and only 2 nurses. And these nurses were frantically running around trying to figure out which babies actually needed attention. And at some point during that time, a baby right in front of me passed away, and we had no idea until hours afterwards. Well, Neopenda's first product, NeoGuard, can help with situations like that. Oh, it didn't actually click. We can help with situations like that. NeoGuard is a wearable vital signs monitor that continuously measures 4 different vital signs, all in a really simple headband or armband. The vital signs from multiple newborns in the room wirelessly connect to a centralized dashboard on a tablet, where a nurse is immediately alerted of any newborns in distress. We take a very user-centric approach to designing our solutions. Our team spends countless hours with nurses, understanding their day in and day out, understanding what the constraints are in the facilities, sometimes even becoming nurses ourselves. We host various engineering workshops to bring local engineers together to really help us design our solution better, understand environmental conditions, dust, humidity, all sorts of things that make traditional equipment fail. We design with local engineers, education, training, ongoing maintenance materials to really make sure that our equipment doesn't end up in that graveyard. We engage various local NGOs and ministries of health to understand how we can integrate our solution into existing strategic initiatives, particularly related to improving newborn health outcomes. We hold ourselves to the highest level of safety, quality, and efficacy as accepted by international standards. So we're doing trials here in Boston at Tufts Medical Center and in Uganda in our target entry point into the market, prior to getting our product into the hands of our users by the end of the year. We've designed Neopenda to be really people first. We've engaged 1,000 stakeholders in the design of our solution and the design of NeoGuard in just the past couple of years. And together, we have a goal of improving the quality of care of 5 million patients in the next 5 years. So we invite you to join us in turning that goal into a reality. Thank you so much.